Hi everyone. So today I'm going to be talking about the importance of prenatal education and some ways you can talk to the patients about it. So first of all, prenatal education is important because it improves outcomes for both the mom and the baby. And as you're doing patient education, it's important to understand the level of understanding for your patients so that you're able to explain to them in a way that they can obviously understand. And it's a lot of information, especially for new parents. So it's always good to follow up with handouts or some sort of a tool that they can take home and read and process later, because it is just an overwhelming amount of information. My suggestion would be to go trimester by trimester. So in the first trimester visit, you want to talk to them about things that they might be expecting or feeling, like discomforts that they might have, obviously nausea, vomiting, fatigue, headaches, sometimes edema. And that also comes along in the third trimester also, when they'll develop more edema. Then just give them ways to cope with it. For example, like nausea, vomiting, try not to eat too much food that could be oily or dry. Toast is always good. For headaches, you can tell them to increase their water intake. If it's too much, they can take some Tylenol. Fatigue, they're just going to need to rest more, right? You need to tell them that it's important to rest. And then the edema, as long as it's not overly excessive edema, like to the hands and the face, then they can relax by putting their feet up and just resting, because basically all the water is going down to their legs. Then you want to talk to them about some red flags, such as vaginal bleeding. Let them know that vaginal bleeding is normal at some points, but it is always good to follow up. For example, vaginal bleeding could be due to trauma from like a doctor's appointment when they stick the fetal, the transvaginal ultrasound in there, sometimes a little bit of trauma, or if they're still sexually active. And then implantation bleeding is also one. Fever, if they have fever, it's not really normal for patients or moms to have fever. Higher body temperature, maybe, but anything over 101, they should get checked out for sure. Severe abdominal cramping, not pain like abdominal pain where your stomach hurts from eating, but severe cramping is an imminent sign of labor, so they should always follow up. Also, if they're just generally not feeling well, it's always good to just get a checkup. And then give them places where they can go. They can go to the clinic, they can go to the hospital where they're gonna be delivering, they can go to the labor and delivery floor where they're gonna be going to, or just any ER to get checked up, as well as the doctor's office, obviously. Secondly, you want to give, like I said, give information based on the trimester they're on, so that they're not overwhelmed with everything that they have to go through. So for example, for the first trimester, which is usually between 0 to 13 or 12 weeks, the first appointment, you would normally do a blood panel, and its various tests. CBC is always good to see how either anemic they are, or if they're chronically anemic, if they have any other underlying lab work issues. You want to get their blood type, and their Rh antibody screen, which will also come into play later in the third trimester. Also, you want to make sure their vaccinations are up to date. Screen them for HIV, Hep B, do a pap smear, test for STDs, and do a UA dip. Then for that first trimester, they have options for genetic screening, obviously. They can do the nuchal translucency screen, which they recommend you do between 11 to 14 weeks, or the chorionic villus sampling, which can be done 10 to 12 weeks. And also they'll obviously do an ultrasound to get the gestational age or dating of your pregnancy. And then during each visit, just let them know that they'll be having their weight taken, their blood pressure, their pulse, their temperature, as well as fetal heart tones. 5 to 6 weeks, if it's still early, they use a transvaginal, but by about 12 weeks, they can use the Doppler. They'll also be measuring the fundal height to correlate with the date and the gestational age. In the second trimester, which is usually 15 to 20 weeks, the genetic testing that can be done they're optional, but an amniocentesis, which can be done between 16 to 22 weeks, and then the quad screen, which checks for neural tube defects and trisomy 18 and 20. At the visit, it's usually the same routine. They check your cervix, they check your blood pressure, your vital signs, and then about 20 weeks they do another ultrasound for the anatomy, the fetal anatomy survey. So they'll check the head size. This is the time you can find out whether it's a boy or a girl. During the third trimester, there's a lot that goes on because they're planning for the for the birth. So you just want to prepare them, ask them about the birthing plan, and then also around 24 to 28 weeks, they do a glucose testing just to make sure, there's no diabetes or no gestational diabetes. It can be done earlier if there are symptoms. So that's just a guideline. They're also going to do another CBC for anemia screen, as well as the Rh antibody screen. They do give RhoGAM if necessary, okay? And then at 36 weeks prior to giving birth, even if it's a C-section, they do the Group B strep test. Now, the one thing to remember about it is it's only good for 5 weeks. So if you do it at 36 weeks and they are overdue over a week, then you need to repeat this test again. So these are just some of the guidelines that you can tell them, and just remember, follow up with handouts. And it's just important to have open communication, especially for first-time moms. Could be overwhelming. They could be a little bit scared. So just be aware of how they're feeling, and ensure that they're comforted and know what to do, because this also increases follow-up care. Thanks.